Dominguez is seeing more cyclospora infections, that foodborne parasite that can make you really sick.
Joining us now to talk about this and more, our mid-team doctor and infectious disease specialist, Dr. Ed Dominguez. Dr. Ed, tell us, what are some of the most common foods often contaminated by this parasite, and how can we protect ourselves and hopefully avoid getting sick from this?
Yeah, Blake, the major foods implicated in these outbreaks are berries, things like raspberries and blueberries, and also salad mixes that are pre-mixed, and then also things like fresh herbs, cilantro and basil. Now, the best way to avoid these infections and food poisoning is to wash your vegetables with a mixture of some type of acid like citric acid and water before you use them. If you're going to cook them, go ahead and cook them to at least 158 degrees. If you're not going to cook them, scrub the hard vegetables very well with the soap, with the water solution before you ingest them.
Okay, Dr. Ed, and some warnings are coming out about increased health risks for people who take GLP-1 medication, especially during the heat of summer. What are those warnings, and what can people do to reduce their risk?
The major warning here, Jennifer, has to do with the issue of dehydration. The GLP-1s are very good at making you not hungry, but also making you not thirsty, which isn't very nice during the summertime. So the big issue here is to try to schedule, if you can, with an alarm clock or some type of reminder, to drink water or some fluids during the course of the day so you don't lose track of it. Also, try to eat more frequent, smaller meals, and then use very water-heavy types of foods. Things like watermelon and cucumbers have a lot of water content. They're perfect for this purpose.
Something else here, the FDA has approved a new drug designed to treat patients with a potentially life-threatening kidney disease. What exactly is this, and how does it work to treat what's known as Buerger's disease?
Yeah, Blake, this is an interesting drug called Trutocna, and it helps to decrease protein called IgA that can build up and accumulate into the kidney. This causes Buerger's disease or IgA nephropathy. We just did a kidney transplant last week on a person with this very disease, so it can be very serious. Now, the drug works wonderfully by preventing this buildup. The problem is it's going to cost currently about $400,000 a year. It's a once-a-week injection, but about $32,000 each month. There are other drugs on the market that it will compete with, but they're all equally expensive, but they can prevent a kidney transplant.
Wow.
Hopefully they can lower the prices of those drugs, make them available for more people.
Yes.
All right, Dr. Ed Dominguez, good to see you. Thank you so much.
Thank you.